Hello, and welcome to the Innovation Forum AI podcast, a space where we explore how artificial intelligence is transforming public health. In today's episode, I speak with Dr. Serina Chang from UC Berkeley, a leading researcher exploring how AI can help us understand and even simulate human behavior. In this conversation, Serina shares how generative models and large-scale data, from smartphones to web searches, can reveal the social dynamics behind pandemics and guide more precise, equitable public health decisions. Welcome, everybody. My name is Oliver Morgan, and today I'm talking with Serina Chang, an assistant professor at the University of California, Berkeley, jointly appointed in computer science and computational precision health, and part of the Berkeley AI Research Lab. Her research falls in the intersection of AI, human behavior, and public health, including simulating human behaviors with generative AI, inferring human behaviors from novel data sources. So, Serina, it's great to have you. We met actually maybe a few months ago during another online meeting. So it's great to have you back. How are you doing today?
Thank you so much. It's great to be here. Yeah, I really enjoyed our last meeting at the Innovation Forum, and it's great to be doing this podcast.
Great. Well, before we jump into the exciting research and work that you're doing with AI, why don't you kind of lay out how you how your research career has got you here and the pathway that you've taken to end up incorporating AI into your work?
Yeah. So I've always been really fascinated by the intersection of computation and social systems. I've always considered myself a computational social scientist first. When I was in college, I did my undergrad at Columbia University in New York City. I majored in computer science, and then I concentrated in sociology. So I've always been looking for these intersections between computation and society. At the time, I started doing some research with Kathy McEwen, who's a wonderful professor there. At that point, it was more from a natural language processing standpoint, which I still do a lot of these days. Then I started my PhD at Stanford University, and I was advised by Jure Leskovic and Johan Ugender, who are both really great people in the sort of network science, graph learning space. And the COVID pandemic hit in the first year of my PhD. So 2020, I started in 2019, and 2020 was just the second quarter that I was doing my PhD, and we were already doing work around mobility data and trying to measure contact patterns between people. At that point, it was more a social science project, thinking about, how do people of different groups mix with each other actually on the ground, as opposed to thinking about residential segregation, a more experienced measure based on mobility data. But then COVID hit, and we were thinking, wow, these contact patterns matter a lot, of course, for infectious disease spread as well. And that sort of opened up a whole new field for me of still studying human behavior very much, but now with a goal towards improving public health and reducing infectious diseases. And so I did my entire PhD on these problems of human behavior, COVID, AI, trying to infer human behaviors, understand policy impacts, all with a sort of AI and data science twist. And I did my PhD at Stanford for 5 years in computer science. And then now I'm at Berkeley, and I'm so happy to be jointly appointed in computer science and this new program called Computational Precision Health. It's a joint program between UC Berkeley and UCSF that basically combines the powerhouses of both, the sort of algorithmic and statistical background with the clinical and the medical backgrounds of UCSF. And so in this program, I'm doing a lot of my public health work there and bringing over the AI and data science as before.
Great. Well, that sounds super exciting. I mean, I think the kind of mixing up of different professional disciplines is really one of the things that I see coming through a lot. It sounds like your center is one that's really leaning into that.
Yeah, I really like interdisciplinary collaboration, largely because my interests myself are very interdisciplinary. I have been trained in computer science mostly, and my major, and then my PhD, and then one of my departments now. So it is always enlightening to see, I think, the way that people from other fields approach problems. Computer scientists have their own particular way. We're often quite methods oriented. We're often quite, we have benchmarks that we've tried to improve performance on. But I think through the interdisciplinary collaboration, there's really a good experience of grounding the problem and what is even the question you should be asking before you start trying to optimize on some benchmark. And then what is the actual real world impact you could have, instead of just looking at metrics like accuracy, thinking, how would I actually deploy this in the real world? And what does good enough mean, of actually grounding everything that you do in real world problems. So I think as a computer science, most of the time, I think that is one thing I really get out of the interdisciplinary collaboration, which is the grounding.
Yeah, that's super interesting. Actually, I was at a meeting yesterday in London, an AI meeting with a lot of clinicians, actually. And one of the things that was fascinating is how many clinicians are doing research with AI. And it really made me think that AI is not really confined to either a data science domain, or sometimes it gets hosted within a kind of IT type setting, but it's really kind of crosses all sorts of different domains and disciplines. And I guess this is particularly you're living and working in that kind of space. But the work that you did during the pandemic was also like super interesting. It'd be really interesting to hear a bit more about that. I heard a little bit about that when you did your presentation at an earlier meeting that we had. But maybe you could tell us a bit more about some of that and how the outputs of the research that you did really kind of fed into some public health decision making on the ground.
Yeah, I'd be happy to talk about that. I mean, the way that I think about my research and how to combine these sort of human behavior, public health, and AI parts, the starting point is that, as you know, human behavior plays a huge role in public health decision making, both in terms of what policies should we implement, but then studying the efficacy of those policies as well. And sometimes there can be surprising ways in which human behavior changes, unintended effects, spillover effects. And the challenge there is that it's often quite hard to actually observe human behavior at the granularity that you would need to make really good decisions. Collecting human behavior, at least through surveys, is very costly. There's also very heterogeneous behaviors across different subpopulations. And so it's not enough to just have one sample. You need a large enough sample and a representative enough sample that you can capture all the different behaviors. And then it also changes over time. And so it's not enough just to have one sample once, but you need to track it over time. So for example, at the beginning of the pandemic, there are these really quick drops in contact and mobility. And so being able to capture changes over time is another challenge. And so against that backdrop, a lot of my work is about how do we use AI or data science to infer or estimate behaviors in a more granular way. And I usually take this from two directions. In my PhD, a lot of the work was, can we infer it from unconventional data sources, like location data from cell phones or search logs from Google or Bing, or these days ChatGPT. That was a lot of my PhD work. And then more recently, and we can get into this later, it's been more from a generation standpoint. So instead of just trying to infer behaviors, historical behaviors, can we actually generate behaviors, simulate human behaviors, oftentimes with generative AI? And so that also combines some of the unconventional data sources, but the focus really is large language models or diffusion models, ways to generate complex behaviors, from mobility trajectories to social networks to survey responses. And so those are the sort of two angles that I have on this problem these days of, behaviors are hard to observe. What can we do about that? And then finally, those estimated behaviors go into some sort of decision-making model. So for example, you might want to decide, how do I lock down safely, or how do I reopen safely? And you want to balance between competing objectives of minimizing infections, of course, but also returning something to the economy. And so that's a common question of competing trade-offs. Or you might have questions of allocation, like maybe you have some finite resource, like maybe early when vaccines first came out, what is the order in which you should be prioritizing groups and allocating vaccines? And so if you can get these more fine-grained estimates of behavior that are also time varying and ideally even real time, you can make more precise decisions. You can actually evaluate the impacts of your policies, and you can try to adapt in real time as people's behaviors change. So that's a sort of big picture view. I can talk more about the work that I did during the PhD if you're interested.
Yeah,
but
super
also
interested.
interested to hear your thoughts here in terms of where you see behavior playing a role.
Yeah. No, I mean it's fascinating, and what you mentioned that you started your PhD just before the pandemic, um, and so obviously there was this kind of line of work already going on before the pandemic started, but I'm guessing that it really accelerated during the pandemic. This area of inquiry and study, and yeah, it's absolutely fascinating. I mean, my experience has been working very much in the public health surveillance domain, is that we focus mostly on traditional epidemiological data and very rarely had access to other types of behavior to supplement that. And actually, that's at the heart of what a lot of the work that we do in the Pandemic and Epidemic Intelligence Hub in Berlin is thinking through not just the epidemiological components, but the other contextual factors such as behavior. And there may be other contextual things too. So yeah, it's exactly, I think, where this field is heading, and it really leans to the strengths of AI and data science as well. And so I saw a lot of it coming out through research efforts as well. But I've always been curious to know how much of the output of that kind of research made it into the hands of policymakers. Were you able to get there, or was it too novel for policymakers to be able to use, or how did you experience that
In a
part of
few
it?
cases, actually. Yeah,
Yeah.
no, I was happy to see that there was an openness to the sort of tools that we were introducing. Yeah, so we were supporting the Virginia Department of Health during the pandemic. This happened through, I was at Stanford, but we had a joint grant with some researchers at University of Virginia, Madhav Marathi and others at the Biocomplexity Institute. And so we worked together to actually deliver actual tools to the Virginia Department of Health. This included the first thing we built that I was involved in was a reopening dashboard. And so, like I said, there are a lot of questions about, there were massive lockdowns at the beginning of the pandemic, but it's not sustainable in the long term. So asking how can we safely reopen without a massive resurgence of cases? Um, and we had built this mobility based model that was published in Nature, and that was the work that we can talk about maybe later. But after the Nature paper came out, we were thinking, can we actually transform this into a tool on the ground for the Virginia department? And so what we did was we met with them repeatedly and we built a dashboard. I can link that in the notes as well if people want to see what it looks like and play with it a little. But it is this sort of interactive dashboard where there are sliders for different levels of mobility, and it breaks down to different types of places too. And so we didn't want to treat every place the same. There's varying risks across the population and across different types of locations. So we had essential retail, we had maybe gyms, we had religious organizations. And so we had different groups of places. And then for each place, you could use the sliders to determine at what level of mobility you wanted. And then the model would predict under this hypothetical mobility plan how many predicted infections there would be for different regions in Virginia.
Great.
So that was the first tool, and we delivered that to them, I think, in early 2021, if I'm remembering correctly. And then we continued working with them. They thought the mobility data was quite useful. And so they had a later problem in the pandemic, which was vaccines were starting to get distributed, and they essentially had a finite budget of trucks. So trucks carrying the Johnson and Johnson vaccine, and they wanted to know physically where should we place these, down to pretty granular geography. So a specific block, like where should I be placing this truck? And they were thinking, and we agreed with this line of thinking, that mobility data could serve as a useful clue for where you should be placing these trucks under some hypothesis of convenience. So if you place it near the grocery store that everyone goes to already, can you get more uptake that way? And certainly, I mean, here I think is another place where human behavior and human modeling matters quite a bit, which is how much of this is convenience versus other things that cannot be tackled by having a vaccine truck right in front of you. But at least for the people where it was convenience, I think this was helpful. And so what we ended up doing is we used mobility data and we looked at it for different under-vaccinated populations, and we came up with targeted recommendations for each of those under-vaccinated subpopulations to say, here are the places that you should be placing your trucks. Um, And in
And
this case, we were.
no, I was just curious whether you had any surprise findings looking at the mobility data, and did you kind of dispel any kind of preconceived notions about what different population groups do or don't do? What
Yeah,
were
I
the
think
kind of
so.
in aha moments for you?
Yeah, we definitely had a couple of aha moments from looking at the data. I think one trend, which is what I was saying earlier, that people have heterogeneous behaviors, and it's important to measure for different people different things that they're doing. It's not enough just to have a single sample that you think is representative for everyone. We definitely saw that coming through with the mobility data time and time again. In the context of the vaccine distribution problem of where do we place the trucks, we basically found that for different populations, like for the Black community, for Latinx communities, their recommendations were very different. And so the places that you would want to place your trucks, where it would be easiest to get to them, it differs based on the population that you focus on. And so this is speaking towards the need for sort of more targeted interventions as opposed to one size fits all. So that was one thing. Coming back to the Nature paper, one of our main findings in that work was that we had a COVID model that would basically model the spread of COVID over mobility networks that we constructed from the cell phone location data. And the model itself did not have access to the demographics of different neighborhoods. So it didn't know which neighborhoods were more or less had more minorities or more or less wealthy. But it was well known during the pandemic that certain groups, so lower income and more minority groups, were getting infected at higher rates. And so what we found that was quite interesting was the model, which didn't have access to these demographics, but did have access to the mobility network, it correctly predicted these disparities across 10 of the largest cities in the US.
Wow.
This was during the first wave of the pandemic. But it basically told us that there are mechanisms in the mobility network that can explain these disparities. And then we looked
Also,
into
the
the mobility
mobility
networks.
was a proxy for all these other demographic and socio-demographic factors, right?
Yeah, essentially, exactly. So the information was sort of encoded in the mobility network
Right.
already and encoded in a way that led to more infections for these disadvantaged groups. Of course, it's hard to say anything necessarily causal here. Like we don't know if the mobility was the main cause. Like it's hard to disentangle the factors, but at least what we do know is that the mechanisms are in there that can result in disparities just from mobility data alone. And it's not that you need, differing transmission rates for different groups that you then fit. The mobility networks alone contain the information that would lead to these disparities. So yeah, we found two mechanisms. The first one is pretty straightforward, that these disadvantaged groups were not able to reduce their mobility as much at the beginning of the pandemic. And this was true across all 10 cities. Both groups, so both higher income and lower income, and both the basically census block groups that we were looking at that had more white residents versus fewer white residents, everybody reduced their mobility. But if you look at some of the plots from our papers, you see these two lines drop, and one of them just doesn't drop as much. And so this could be because these groups were overrepresented in essential jobs or less able to work from home. And so even when there is a citywide lockdown or social distancing order, it affects people differentially depending on their circumstances. So that was the first result. And then the second result was that it's not just about how often you go out, it's also about where you go. And we found that even conditioned on the type of place, so whether that's a restaurant or a grocery store or a gas station, even conditioned on the type of place, the places that these disadvantaged groups were going to were smaller and more crowded, and they had longer wait times. And these were things that we could see from the data. And so all of these things from the mobility data pointed to these disparities. And as you say, the sort of encoding of demographic and circumstantial information just in the mobility data itself.
Wow, that's really fascinating. I mean, so how is this taking us forward? So we had this experience during COVID-19 pandemic. I think, mobility data was extremely important for many populations and for many public health efforts. So, how are we taking this forward, or how are you guys taking this forward and thinking about, using, AI to understand people's behavior, feed that into decisions, and maybe go even beyond that and thinking about simulating behavior, which is something that I know that you've been working on.
Yeah, this is a great question. Before I explain that, let me take a step back and tell you about how I look at simulation and what its sort of use is, and maybe what its use isn't. Um, so I think of simulation as quite useful to this original problem of behaviors are hard to observe. It can tackle some of the things that inferring from novel data sources can as well, but also some things that inferring from novel data sources can't do. One big thing is privacy. And so, like I mentioned before, the safe graph data, for example, is only at a neighborhood level. And so we can't observe individual level mobility patterns, and we probably wouldn't want to. At least we wouldn't want to release data on that. And so privacy is a big challenge. With simulation, you are able to simulate synthetic behaviors at the individual level, maybe even for synthetic individuals. So that there's a sort of double privacy protection there, where it's no longer mapped one-to-one to a real person, but it's sort of this hypothetical person with these demographics who lives in this city, who works in this location. Then you can generate, for example, what we're doing now is generate a synthetic mobility trajectory for a synthetic individual. So the synthetic mobility trajectory looks at things like what is the actual sequence of places that this person goes to. Maybe they start at home and then they go to work and then they go to the gym and then they go to dinner with some friends and then they go back to home. And so you have this time-stamped sequence of locations visited for a person. And being able to generate that, yeah, for privacy reasons is super important. It's also very important because when you infer from novel data sources, you are still constrained by what historically happened in the past. You still have to wait for the data to come out, and you can't explore the future, and you can't explore what ifs. And so what do you do when there are behaviors that literally cannot be observed because they have not happened yet? So in particular, these sort of future and counterfactual behaviors, which are extremely important to public health decision makers. Forecasting just to be able to know what's coming, and then counterfactuals to know what would happen if I had this policy versus that policy. And you're only ever going to see one rollout of reality. And so you can't explore these counterfactuals with only data sources that reflect what actually happened in reality. So I think that's the other power. I think privacy and, behaviors that cannot be observed.
You can and scenario, like running scenarios. I mean, it reminds me of the problem that's kind of well recognized, but often an issue that comes up repeatedly is with school closures. So, school closures to prevent, let's say, influenza transmission, results often in kids staying at home and actually increasing the amount of transmission within the household. And those types of scenarios actually are you have a kind of unintended secondary consequence. And as you said, it's really difficult to foresee what those are. So I'm guessing that the simulations using synthetic behaviors and synthetic kind of populations allow you to run those kind of scenarios and think through what might be some unintended consequences that I'm not thinking about.
That's right. Exactly. Yeah, I think through simulation you can realize things that you might have, like the second order and then the third order effects that you might have not been able to think through, because it just becomes intractable after a while.
Right. Yeah. So how do you start training AI models to behave like a synthetic person?
Yeah,
at least from a public health perspective.
Yeah. There's a couple of methods. So we've been doing some work around large language models and LLMs, as I'll call them. And they've been very promising for simulation for a number of reasons. As you probably know, they are these sort of natural language generators. And so they're able to both take in any sort of prompt in natural language. So that means you can describe the person who you're trying to simulate, you can describe the behavioral task that you're asking them to do, and then you can describe the environment with quite a lot of detail. And this is in contrast to maybe more traditional agent-based models that are these sort of stylized mathematical models that tend to have, a set of actions they can take, and it's very clear what they can and can't do. Large language models are a lot more flexible in this way that you can describe, anything you want about that person as long as it can be written in natural language, and you can ask them to do anything. So that's the first thing. I think flexibility in inputs. There's also flexibility in outputs because they themselves are generating language. A lot of more stylized models have a very small set of actions that they can do. Like it might be like, oh, I'm going to wear a mask, or oh, I'm going to go to that location. But large language models, they generate text. And so then you could have them generate, even open-ended text. Like you could simulate a social media ecosystem where people are posting and commenting and replying to each other. Or you could simulate, in our past work, we've simulated social networks. So basically, the formulation of a social network. And we had each large language model embody a individual, and then we wanted to see what is the structure of a social network that emerges between these large language models. And so they're able to output these sort of discrete units to essentially the edges of the network, saying, who am I connected to in the network? So it doesn't have to be text. It can also be, these discrete objects. We've also used large language models for surveys. So essentially as what we call synthetic respondents for surveys. And so you have a large amount of human data where they have responded to surveys, and can you try to augment those surveys with synthetic respondents for imputation or extrapolation to unseen individuals, where you can actually have them respond as if they are a person and answer a new question. And so in all of these cases, I think the sort of setup is quite nice, where you can do language in, language out. They've also been pre-trained on a massive amount of data, so basically the entire internet. And that contains a lot of human data and things about humans that can be useful. What that means is that you can often do what's called zero-shot prompting. And so without any additional training, you can get a behavior out of the model immediately. And there is a question of how well those behaviors work. Like they are somewhat realistic, they have their flaws. But even just the ability to do zero shot, I think, is quite powerful, because you often are in situations, especially with these counterfactuals, with a completely unprecedented pandemic, where you don't have data, where you can't actually train the model on anything that is applicable to your current problem. And so if it can do some sort of just generic reasoning over what it knows about humans and produce an action or a behavior on the spot, that is quite valuable, if zero shot is still more informative than nothing. And so the status quo is sort of nothing, and is zero shot more informative than that? I think it probably can be.
Yeah, I mean, that's fascinating, because we're looking at similar problem sets where you start off with a new event, new infectious disease event, and you essentially have very little information about how it's actually being transmitted. Some of the epidemiological parameters are unknown, and the dynamics are unknown, and so you have to make some type of assessment. And at least one area that we're working on is to collect what we know about other diseases and other which transmit in similar ways, and you can at least have a starting point and then supplement as you go forwards. And another area that's as you mentioned, it's made me think about it, is that before LLMs were widely available to public health researchers, we relied a lot on the kind of agent-based models, which are very computationally demanding. But what is the case with LLMs? Are these the kind of LLMs you can run on a standard computer, or do you need to have huge compute capabilities to do this kind of work these days? I mean, what are the practicalities of it?
Yeah, I mean, I think that is a great question. And I think it's an open question right now of people are very excited about LLMs for simulation, but whether you can actually use it for an agent-based model at the same scale that we were doing before, for maybe thousands or even billions of individuals, that is a challenge right now. It is a bottleneck of not being able to scale when you use large language models, because they are so computationally expensive, even more than the original models. So we are quite interested in my lab of figuring out computationally cheaper ways of getting these models to do a better job. Before we get to the these agent-based models with millions of people, starting off with a simpler example, which is just, can you use an LLM to predict? In this case, we were doing public opinion surveys, and we wanted to understand, can a large language model accurately predict an individual or a group's response to a public opinions question? And this is quite useful because, as a survey designer or as a public health researcher, you might want to understand, what is the sort of sentiment right now towards a lot of different things like vaccines or lockdown policies, or more broadly, any sort of social issue. And what we found was that, the zero-shot methods themselves, prior work had shown that they have issues. For example, they tend to underestimate variance within populations. And so it tends to be, the real human distribution, even for a given group, like maybe women or men, there's more spread in that distribution than what the LLMs would predict. So the LLMs would be very confident and say, women all think like strongly agree here. And so that was one flaw with them. And then sometimes they also had tendencies to lean towards certain groups over others. And so we tried to fix these problems in two ways. One of them was to do direct fine-tuning. And so you might have heard of fine-tuning. It's basically, these large language models have been pre-trained on a ton of data. Sometimes they go through human feedback training as well, but then they're released by Meta or Google or something, and you can download the model onto your own computer. And now fine-tuning means training the model on some downstream particular task. And you don't train too much. You don't want to lose everything that it learned from pre-training, but you train a little bit and you adjust the weights a little bit. And so this is distinct from prompt engineering, where you're not changing the model weights. You're just changing the input to the model, and you hope that that changes the model behavior. Fine-tuning actually goes inside the model and changes its weights.
With fine-tuning, are you able to do that dynamically? So would you be able to, for example, continue to fine-tune a model as you went through an infectious disease event and you learn more and more about the pathogen as well as the response from the population?
Yeah, you could definitely do that. Yeah, that's a good idea, actually. The sort of continuous fine-tuning as you get more information. But yeah, so you can do fine-tuning, which basically adjusts the weights of the model, but there are more parameter-efficient ways to do this. So PEFT stands for parameter-efficient fine-tuning. For example, in our work, we used low-rank adaptation. So it basically assumes a sort of low-rank matrix and only makes changes along those rings. So in our work, we basically use this sort of parameter efficient fine tuning and showed that the performance improves substantially. And so we fine tuned on real survey data. We curated a large scale survey data set of 70,000 data points that basically said, here's a group, here's a question they were asked, and here's the distribution of their responses. And then we directly fine tuned the model to predict that distribution. Specifically through its next token probabilities. And so we use this sort of distributional loss, the KL divergence, by minimizing the KL divergence between the model's predicted distribution and the true distribution from the humans. We showed that this actually generalizes very far to unseen questions. And so when you fine tune, it's like, of course, you're going to do better on the questions that you fine tuned on. But the question really is, will this generalize to unseen survey responses? Because that's really how practitioners will be using it as well. They're not going to be asking about a survey question that was asked to a population that they already have the data for.
And I guess the $1 million question is always like, how do you evaluate whether the fine-tuned model is performing well? I mean, practically, how do you evaluate these kinds of things?
Yeah, so I think you have to be quite careful about your data splits. And so think about what you fine tune on versus what you test on. And in this case, we fine tuned on, I think around 52 or 53 waves of the American Trends Panel. So this is a US representative survey that the Pew Research Center conducts. And then we tested on unseen waves of the American Trends Panel, but then we also tested on a completely different survey, the General Social Survey, which is still US representative, but it's conducted by NORC at UChicago, different organization, different panel that they're sampling from, different survey, post-stratification techniques and so on. So we tested those, and then we also tested on unseen subpopulations. So we fine-tuned on 22 demographic groups, like, women or people without a college education, people with a college education, and so on. So 22 demographic groups. But then there's a lot more demographics out there that we didn't fine-tune on. So we also tested on generalization to those unseen groups. And so we had this sort of battery of different ways of testing the model. And we actually found I think 41 to 48% improvements over just the prompt engineering and the scale of improvement
huge.
generalized. Yeah, large improvements, like almost 50%. From fine tuning, but importantly, that would generalize to these unseen surveys and to the unseen subpopulations. So that was our first work. But even fine tuning is still somewhat expensive, even if you do parameter efficient fine tuning. And we were doing this with smaller models, doesn't sound that small, but 7 billion models, meaning they have 7 billion parameters as opposed to, ChatGPT or the real models that are running in production, which tend to have hundreds of billions of parameters. But there are even cheaper ways to do this. So in work that we just submitted to a conference, we showed that fine tuning is useful, but you can actually get around 70 or 80% of the improvements that you get from fine tuning if you just open up the model and you look at the model's internal activations, and then you just train a simple logistic regression classifier on top of those activations. Wow. So I can explain that a little more. What that means is these models, they're massive, right? They have 32 layers. Every single layer is a transformer block. A transformer is essentially this sort of sophisticated deep learning architecture that takes in what's called the residual stream. So the residual stream is sort of like the LLM's memory as you go through all 32 blocks, and it records everything the model knows up to this point. And then when you enter the transformer block, the residual stream is then edited by what's called attention heads and then by a multi-layer perceptron. Doesn't really matter what these things are, but it's basically these little layers that then affect the residual stream. And the residual stream goes all the way through from layer 1 to 2 to 3, all the way to layer 32. And then finally, the actual outputs that you get from the large language model is you take the final residual stream, so from the 32nd layer for 32 layer models. Some of them are bigger, some of them are smaller, but we mostly looked at 32 layer ones. You take the final residual stream and then you apply a final linear layer on it to essentially decode it back into tokens. And so the residual stream is like this sort of vector representation with something like 4,000 dimensions in it. And then you want to decode it back into tokens that can then be produced. And so a token is, for example, the word and, or the word potato, or just even a single letter. And so you take this sort of continuous vector representation and decode it back into the words that the LLM is spitting out. And so what we showed in this work is that when LLMs fail to predict human opinions correctly, it seems to be actually more of a retrieval problem that's happening at the end of the model. But if you go deeper within the model, like the middle layers of the model, there's a lot more knowledge encoded there than is actually getting spit out at the end. And so if instead you just take the knowledge that's encoded in the middle of the model, like the residual stream in layer 15 or something, and then you just train a very simple logistic regression classifier on top of it, has maybe hundreds of parameters instead of billions, you get 70 or 80% as good of the improvement as you would have seen from fine-tuning the whole model. So that's another way in which you can improve the sort of This is a long answer to your question about computational efficiency.
I mean, it kind of like gives an indication about where this might be heading and how accessible it might be, in the future. Because I think I'm going to say something in a very generalized way, but the large language models, there's a lot of debate about whether they're continuing to improve or not, and there may be a bit of plateauing. But maybe some of the more important questions are, around fine-tuning, around the cost of running LLMs, about accessibility and just practical aspects. And so I think that it sounds like there's a lot of work going on into actually turning the LLMs, rather than just trying to push more input into them to get more output, really start tweaking them and using them for specific purposes. So this is really fascinating. Wow.
Yeah. No, I think that's right. That's sort of the direction that this is going. And especially if we want to deploy these at scale, like you were saying, to the agent-based model scale.
And also sounds technically a little bit more accessible as well to a large number of people who may be familiar with, logistic regression as a fairly, straightforward statistical kind of technique that most people learn, in a graduate course.
Yeah, exactly. I think that's another nice thing, which is that more people can participate in this kind of research.
Wow, that's really fascinating. Um, so, I mean, just kind of thinking about where things are heading. I mean, that's obviously one area that you and your team are pursuing. Where do you think what's going to happen in 2026, and where are some of the directions of research in this space going? And maybe it would be also interesting to know whether there's a large community of people working on these things, or whether it's a fairly niche thing that you guys are doing.
In terms of where things are going, I think as as it applies to public health applications, I think there's been a lot of hype around LLM simulations and excitement around it, mostly from the computer science space. So I think people from natural language processing or human computer interaction or machine learning, all of these groups are quite excited about the potential. But I think of actually realizing that potential in a really concrete way where we can quantify the value of these over what we had before. Actually running experiments, actually trying to deploy these models in a safe way and seeing the sort of gains that you get. I think that's maybe the next wave so we've done these sort of initial explorations. We've written the research papers where we show, okay, there's promise here. And so now how do we actually turn that into real value on the ground for different groups? And so I think within public health, that would mean, can you actually build an agent-based model and integrate LLMs into it? Where's the right place to plug it in? I think for survey research, it's about what is the right sort of hybrid human LLM design where you still certainly have human participants. This should not be replacing human participants, but how can you augment the efficiency of the survey or the effective sample size through LLMs? So for example, can you predict questions where there's an obvious answer already, and then allocate your sample towards questions where you have greater uncertainty? And so this could reduce participant burden or reduce the cost of the survey, which means maybe you could run it more frequently too, or maybe run it for more people. And so I think that's sort of the next stage, which is trying to deploy these things and see real world value. And I think also along with that, it's going to require, as we were saying at the beginning of this talk, interdisciplinary collaboration and of actually communicating these pretty complex models to people who aren't working with them every day and coming up with measures of trust and of certainty or uncertainty, and figuring out how to combine that with more traditional methods that are already being used in existing pipelines. So yeah, I'm excited to see where all this goes, and if it is a bubble or if it really is going to turn into something that has real world value. And so that's the direction that we're pushing in.
I've heard of a few other people talking about using LLMs to enhance various other types of public health research. But yeah, how is this like a big wave? Is this a big trend of within the field?
Yeah. I think it is. Yes, I think it's there's a lot of excitement in the area right now. Papers just constantly, I mean, computer science in general publishes very quickly because we don't publish journal papers as much. We tend to publish conference papers, which are, 8 to 9 pages, as opposed to, and they can have long appendices, of course. But these are more like, nuggets of like 1 or 2 really interesting results, as opposed to like a journal paper, which means that the field moves very quickly. I'm teaching a course right now. A lot of the papers that I'm teaching are from 2023 to 2025.
And even 23 sounds old, right?
Right, exactly. Yeah, and these models are changing so quickly too. Like large language models didn't even come out until the last few years ago, but now they've really taken the world by storm. So yes, I think there's a lot of excitement in this area from computer science right now, but of actually doing the work and deploying one of these or more of these and seeing what's going to happen will it just fall apart or will it actually create real value? I think that's where we need to go next.
Well, I'm really keen to see how it actually unfolds in the real world. I hope we can be part of, trying that out and testing it out. Just, because a lot of people are obviously worried about LLMs for all sorts of reasons. Maybe just, what are your reflections on, some of the real challenges and pitfalls that you might have come across, but also, some of the maybe kind of perceptional challenges that you've got when dealing with as you say, combining, human and LLM type approaches?
Yeah, I think there is skepticism or concern, and it's very well founded. These LLMs are trained by model providers who often don't disclose what they were trained on, and then they're just given to you as this thing. And it's even the people who created them don't quite know how or what skills it has or how those skills emerged from just next token prediction on the internet. Um, so I think these concerns are well founded. Within simulation in particular, works have shown concerns around, for example, stereotyping. If you prompt it to act like a certain group member for underrepresented groups, it often tends towards more stereotypical language. Some works have shown political bias in these models, especially after going through human feedback. Sometimes they become a little more left leaning. So more on the liberal side in the US context, at least. We have a work showing that they actually overestimate political polarization. And so this is where we were trying to have them generate social networks and see who became friends with whom under LLM agents. And they mostly got the structure of the network. So they saw that there should be community structure. They got the sort of long tail degree distribution, which basically means there's a few people who are very popular and then most people are not that popular. So they got all that, but they consistently overestimated the likelihood of Democrats to be friends and underestimated the likelihood of Democrats to be friends with each other, and then underestimated the likelihood of Democrats and Republicans to be friends. And sometimes to such an extreme case that the network would fracture into two disconnected components. And so you just have the Democrat bubble and the Republican bubble. Of course, this is again in a US context, so it'd be interesting to see if this generalizes outside of the US and to non-two-party systems. But at least within this US context, it seems to have learned from all of the data that it read online that they can't be friends and they don't interact, and to really over-index on political affiliation as the thing. And so I think as we use these models going forward, that's why validation is such a big issue of you can't just use these models out of the box, but really test it on historical data as much as you can, and test whether it really compares to human behaviors. And after you do that, to have a sense of where its limitations are. So for example, all of these things that I mentioned came out of comparing it to human data and then developing the methods to correct for these biases. And so I think both fine-tuning, or the second thing that I mentioned, which was we call this probing. So extracting the activations and then training a simple classifier on top of that. Those are two methods that definitely help with these sort of biases. Like, for example, in fine-tuning, when you fine-tune on the distribution, then the model actually learns the distribution for different groups. And it can better make predictions for, across these 22 demographic groups, but also even for unseen ones. And we saw that the performance improvements that I mentioned, this 41 to 48%, it was consistent across subpopulations. So it wasn't just overall, it was a good number, but some groups were seeing larger improvements and others weren't. We saw large improvements for every single group that we fine-tuned on. And so I think keeping an eye towards these sort of biases and then having solutions for mitigating them is the direction we need to go in.
Yeah, it's super important, especially in public health, where issues of equity and vulnerable populations are super important. And it's obviously limited value if you've got a great model which doesn't treat vulnerable groups or minority groups properly. Obviously, that's super important. Maybe just to kind of round us out and kind of wrap up some of our conversation, I'm going to ask the dreaded question about where you think we're going to be in the next couple of years. I'm probably not ask beyond 2 years because things are changing so quick. But where would you like us to be in the next couple of years?
Yeah. Yes, I think coming back to what we were saying earlier of actually seeing these things deployed and seeing real world value, I think that is the sort of trend. If you're going to keep it to just 2 years, then probably a very similar answer to before, which is it'll take time to deploy these things. It'll take time to see what their faults are once you actually put them on the ground. For example, the scaling issue is an open question that I don't know a good solution for yet. Traditional agent-based models were already very expensive to run simulation for and also to do calibration for. So meaning you have some unknown parameters in your simulation model, and then you need to fit them somehow to real data. And calibration can be quite hard, even for traditional agent-based models. And then now you bring in this multi-billion parameter model to replace every single agent. How is that going to scale?
But maybe it sounds like lots of exciting research ahead, but maybe people working in local public health department are not going to be seeing their day-to-day work completely transformed in the next 2 years with these types of technologies, at least not quite yet.
I would hope so. I think we're not there yet. I don't think it's time to, be integrating LLMs into every part of the pipeline. I think it needs to be done carefully. And I think there needs to be rigorous research experiments first, where we actually start to do this kind of deployment, a sort of LLM in the loop survey pipeline, or an LLM in the loop agent-based model. And actually constructing, as we were saying, the validation resources to know whether it's doing better or not, or is this just hype? And so if you construct this LLM-based agent-based model, is it actually doing better than the traditional agent-based models? And there's often very little validation data, especially at the society scale. Like you only have maybe COVID cases for an entire city or for a county, one number of cases per day, and you fit this really over-parameterized model to maybe 60 or 80 data points. And so do we even have the data to know, are all these bells and whistles worth it? So I think constructing the validation resources and doing the careful tests, I think that's where we should be in the next 1 or 2 years. And then after that, if we see the promise and it's still there, I think this could really revolutionize the way that we do things.
Well, that's a fantastic moment to end. I think it provides both the way forwards and maybe some reassurance for people who are listening that, these technologies, although they're moving fast and there's a lot of hype, there's also a lot of work ahead of us to make sure that they're, deployable in a way that's going to be really helpful. Well, Serina, thanks so much. It's been great. I've been wanting to learn more about your work for a long time. It's a real privilege to be able to have all of this time to listen to the types of things that you've been working on. And maybe we'll come back in a couple of years and see where we are.
Yeah, that sounds great. Thank you so much for chatting with me. This was a lot of fun.
Great. Thanks again, Serina. Thanks so much for joining us for this episode. We hope you enjoyed it as much as we enjoyed making it. Be sure to subscribe and share this podcast with your friends and colleagues. We'll see you next time.
The Innovation Forum AI podcast is produced by Zoila Leiva Rioja and brought to you by the WHO Hub for Pandemic and Epidemic Intelligence. We'd love to hear your feedback and ideas. Reach us at pandemichub@who.int.